Hello friends, here I am going to introduce scapula in very simple terms. You can see the anterior view and the posterior view of the scapula. In the anterior view and both in the anterior and posterior view, which geometrical figure does the scapula represents? Yeah, of course, it's a triangle. It represents a triangle in both the views. You can make out the triangles here. Okay, very good. Now, what is the orientation of the scapula? Or I would rather say which alphabet shows orientation of scapula? Okay, think about the alphabet V. V, okay, V, yeah, that's right. So alphabet V stands for vertical, V for vertical, yeah, it is V vertical, and the angle is inferior. So inferior angle and the vertical orientation of the scapula. Now let us go to the borders, surfaces and angles of the scapula. Now it's obvious that there are two surfaces. So the anterior surface is here and that's the posterior surface. Okay. So the posterior surface, when you look at the posterior surface, again you will have to bring in one more aspect of the scapula, that is what is called as the spine of the scapula. So what exactly is the spine of the scapula? So here I would like to bring in one more triangle. Here this triangle is not vertical, it is horizontal. So this triangle with this apex here, with this posterior border here, that is called the spine of the scapula, and the anterior border, obviously as it is placed horizontally, it is fused to the posterior surface of the scapula. Now if I track the posterior border of the spine, it is going to arch out like a process called as a acromion process. So that's a acromion process seen along the spine of the scapula posteriorly. So if you look from the anterior view, as you can see from here, you can see the acromion process pointing forwards from behind. Okay, so that's it. Now what is remaining is the three borders and three angles of the scapula. Now we already discussed this is the inferior angle. So opposite the inferior angle is the superior border here. All right, now two more angles has to be found out. So look at this. This is the glenoid process, glenoid cavity of the scapula. So this angle is a lateral angle. So you can see this is a lateral angle. Why it is a lateral angle? Yeah, answer is very simple, because your head of the humerus articulates with the glenoid cavity to form the shoulder joint. So as the shoulder joint is located laterally, glenoid process is lateral, and the glenoid process is lateral, and the border corresponding with the glenoid process, that is a lateral border. So that is going to be the lateral border. So it's very simple to make out the borders and the angles of the scapula. So that's the lateral angle, that's the lateral border, opposite is the medial border. Similarly, from the posterior view, we can see the lateral angle, lateral border and the medial border. Now, so one more angle is left, that is going to be the supromedial angle. So that's a medial angle located superiorly, so we can call it as a superior angle. Now what is remaining is okay, let me track my fingers along the superior border now. Here, you can see the superior border here. Okay, my hand will go into a notch called as a suprascapular notch, which is located on the superior border of the scapula. So obviously the name corresponds to the superior border of the scapula. It goes along a process called the coracoid process, a beak-like process located on the superior border of the scapula pointing forwards. So that is the coracoid process. So from front view, we can make out three processes: the acromion process, the coracoid process and the glenoid process of the scapula. From posterior view, we can make out the spine of the scapula, which divides the posterior surface into a supraspinous fossa and an infraspinous fossa. And the anterior view, there is only one surface in the anterior view, that is a subscapular fossa. So that gives you an orientation of the scapula. Thank you.